For this year, Africa Digital Health Summit, we're interested in driving, on promoting work around One Health. And in achieving that, we look at the value of digital innovation and the use of data to really advance the work on One Health. Technical session today will be kicked off by a very well-recognized public health expert in the field, in person of Dr. Jibril Idris Manu.
Any surveillance system that is designed and is not designed to reduce disease burden and poverty is definitely questionable. But how can we achieve that without health information system that is designed across geographies? So these geographies goes beyond the regular geography we know in terms of place, but also in terms of diseases and in terms of species, whether it is animal species, whether it is human beings, or it is the plant kingdom.
Where we are now, we need bold leadership. We need intentional partnerships around working on this together. And so I would say we should have an open mind, be very engaged in this conversation from these experts, my colleagues, who are going to be sharing their insights. And then afterwards, we can have our questions, engage in conversations. And just to say that eHealth Africa is here, proud, already yielding that future, and very much happy to work with you.
It's a lot of emphasis around building health system that centers around human or responding to human health, and little around building a nexus between human health, environmental health. From the technology point of view, what role do you think AI, machine learning, and data analytics can play? And is there any existing model that has been used that will help build this nexus?
There are so many things to do, but I think it's better to start with the usual suspect, which is what? It's the early warning systems and also prediction systems. That's what comes to mind anytime we hear AI, ML, and big data.
The idea is that we have different platforms. We have DHIS2 platforms, so all of our data goes up there. They have open LMIS. I'm like, oh, okay, that's what we're using now with tracking vaccines and all of that. Okay, so what are the different types of information we can harness from that? What is key for me and what defines success, whatever innovation or technology we use, and whatever research or scientific metrics we deploy, and whatever big names or innovation we call them, what defines success for us is our ability to be able to predict, to be able to prevent and respond to outbreaks.
Because some structures are placed in the health sector, but in the animal and the environment, they are not there. So we are being assessed based on One Health. So it goes for us to ensure that we work towards One Health approach all of our activities.
What that means is that we are at the point in our evolution where we understand that health is not just what happens in the body, it's what happens around it, it's what happens with animals. And dinosaurs became extinct because they refused to change. If we don't adapt to the reality and to the new knowledge there is, I don't want to say we'll become extinct,